Okay, good morning, Dr. Anderson.
Good morning, Sandy.
Thanks for joining me today and talking to everyone out there listening about COVID. First, I just want to go over and introduce you for people who do not know you. Dr. Anderson is a pediatrician and an integrative medicine physician who has been practicing in Bismarck for the past 10 years and at Mid-Dakota Clinic and St. Alexis Medical Center, where she has served as the chair of pediatrics. She is the founder of Nurturing Wellness Pediatrics, which specializes in pediatric telemedicine. In addition to her practice, she is also president of the North Dakota American Academy of Pediatrics. So, welcome. And today, Dr. Anderson is going to talk a bit about pediatricians' view during COVID. When this got started, I thought of you right away, and knowing that we were transitioning a lot of our programming at Prevent Child Abuse North Dakota during the month of April for Child Abuse Prevention Month, and I reached out to you. So I'm really thankful that you're able to speak with us and talk to families who have concerns about COVID-19 and how that impacts specifically the pediatric population. So what are some of your thoughts and observations and recommendations that you might make regarding COVID-19?
Absolutely. Well, let me thank you and Pecan Sandy for hosting me here today. I'm excited to talk about this topic because it's obviously on all of our minds. And let me just start off, our first case of coronavirus, COVID-19 in the country was in mid-January, and it was in Washington State from someone who had traveled over to China, to the Wuhan province. But what has occurred since then is 2 months after that, we started to see everything shut down, and we've experienced that here in North Dakota as well. So we're just over a month into shutdown, and it's kind of hard for us to know what we're walking into or what to expect moving forward. What I'll do is I'll talk a little bit about how the virus works, what the symptoms are, how we spread it, and how long we can pass it on. And then I'll talk more specifically about issues related to our pediatric population. And so coronavirus is an infection it's called a coronavirus because it looks like a crown under the microscope. So it's just basically based off of the structure that it looks like when we look at it. So this virus is spread through three main mechanisms that we know about: droplets, just like any other virus. If you have a cold or you have RSV or you have influenza, it's spread through these droplets, and these droplets can land on different places like surfaces. And then if you touch that surface, then you can also, and you rub your eye, you can also get infected that way. We also have learned that it's spread through the stool, so that some of it is spread in the stool, and if there is any of that contact that is made, that it could be spread that way. And then lastly, as we learn more about this virus, we're finding that it seems like there is an airborne component, or that it lives in the air for longer than just the period of cough or period of sneeze. And so some studies have looked at it, being present in the air for several hours after someone would cough or sneeze. For surfaces, it just depends on the type of surface, but we've seen it on surfaces for several days. When they've looked at some of the cruise ships, depending on the types of plastics that it was on, it has lasted a couple weeks on some of those surfaces. And so because of these ways that it's spread, we've made a lot of really strong recommendations in various cities across the country to wear your mask. So in places like New York and Los Angeles, when you leave your house, you need to wear a mask from when you step out of your house. Places will not serve you if you're not wearing a mask. Like if you go to the drugstore, you're not able to come in without wearing a mask. And then very, very strict hand washing. And there have been those videos out there on like the pepper in the water and what happens if you put soap in it. We can see that the soap actually does help to get rid of those germs. And so really, really good hand washing where you're singing the alphabet a couple times while you're washing your hands. And then practicing that, upon reentry to your home as well. And so what we've found, and some of the reason for the recommendations that you guys have heard, is that the incubation period, or the period from when you have been exposed to the virus and you develop symptoms, can be up to 14 days. For most of us, it's 4 to 5 days after an exposure that we develop symptoms, but it can be up to 2 weeks. And so that's why if you've traveled somewhere, or if you've had an exposure and the Department of Health has called you, you need to self-quarantine for that 2 weeks to make sure that you don't develop any symptoms. And one of the different things, and a little bit of one of the concerning things about COVID-19, is that you can spread the virus even before you have symptoms. So this is a little bit different than, influenza and RSV, where we don't believe that you can spread it before, but that's part of the reason for the strict quarantines that we're seeing. And then, a lot of people have asked, like, how long can I spread this? How long am I shedding this virus, and how long can I spread it? And we don't actually, know a true answer to this. It depends on where you're shedding it. But anywhere from 8 to 37 days, you could still be shedding virus. And that means in your fluids from your head, but also in your stool. And we do believe that stool shedding lasts longer. So, practicing good hygiene around toileting and around eating is really very, very important. So the symptoms of COVID-19, the typical symptoms are like you have a fever, you feel really, really tired and wiped out. So very similar, like flu-like symptoms, decreased appetite, you can have body aches, you can have cough. But there was a recent article actually today in the New York Times that there are people that have tested positive and shown that their oxygen level has been low, and when they do an x-ray, they see that they have a full-blown COVID pneumonia without the symptom of cough. And so, day by day, week by week, as more data is being brought together, we are learning new symptoms of the disease as well. There's rash, there's been a loss of ability to smell, and loss of sensation that's been noticed as other kind of odd symptoms of COVID-19 as well. And so, that's kind of the general overview of the symptoms, how you spread the disease, how you can prevent yourself from getting the disease. And, as it relates to the pediatric population, actually, North Dakota American Academy of Pediatrics about a month ago, so about a week into our kind of state shutting things down, we had a meeting virtually where a pediatric infectious disease physician from Fargo came and spoke with us about, all of these things, and then, fielded some questions. And so, the good news for the pediatric population is that nationally and globally, we're not seeing high rates of severe disease or death. We have seen some deaths in this country in the pediatric population, but none that show a pattern that is placing children at higher risk for disease. We do believe that children are a vector of disease, so that they carry this and they get infected with coronavirus, but that they're not getting very sick. And so when we look at numbers of infection and numbers of infection of people under 18, we're not seeing high numbers, because most of the time this population is not being brought in or not being prioritized for the limited testing that we do have available.
Yeah.
So that's kind of the good news for the pediatric population. But, as we've seen in other states, really who we're trying to protect are the at-risk populations, which are people with other illnesses that predispose them to having more severe disease. And we're seeing these illnesses like high blood pressure, diabetes, heart disease, very common illnesses that we see as we age in this country. And so the higher risk population is really the elderly population. And then those of us that have these comorbidities or other illnesses that predispose us to severe disease. Also, asthmatic. So anything that would affect your body and your overall inflammation, your lungs and your heart would put you at higher risk of having more severe disease.
So I have asthma, so you would say that I would be at higher risk if I were to contract the disease or have it. Is that what you're saying? Just as far as my illness? Yeah.
Yes.
Okay.
And, despite there are a number of children that have asthma as well, but what we haven't seen is that in children with asthma that we're seeing disease comparable to the adults with asthma or other predisposing conditions for severe disease develop significant symptoms like we're seeing in adults and older populations.
Okay. We were talking last week about breastfeeding. And what are your thoughts about that as a pediatrician? And say mom is breastfeeding and mom gets ill or is concerned that she could get ill, and how does that impact the infant or toddler? What are your thoughts behind that?
So there's actually, this is unfolding, and I'll talk about two things. We'll talk about breastfeeding, and then we'll talk about delivery as two main topics. So how to address COVID in the neonatal population and in infancy. And so for breastfeeding, the World Health Organization had put out very clear recommendations a couple weeks ago about continuing to encourage breastfeeding while taking precautions. And those precautions are really great: hand washing before handling baby, making sure that mom is wearing a mask when she's providing feedings to baby. And that recommendation was taken on by the American Academy of Pediatrics as well, until we did start to see a couple of infant deaths related to COVID in this country. So the American Academy of Pediatrics actually has, on August 2nd, came out with a working document that made recommendations to separate babies from moms if moms tested positive for COVID until resolution of symptoms. And so, the recommendation from the American Academy of Pediatrics is a very conservative recommendation. It is a working document, and really in that document, it discusses having a very candid discussion with parents as to what the risks are, what the benefits are, and also in that conversation discussing the risks of separation between parent, mother, and child after delivery, because it would be a period of quarantine of up to 2 weeks. So right now there is not consistent agreement between the World Health Organization, the Center for Disease Control, and the American Academy of Pediatrics on how to, as standard, manage mothers with COVID infection around delivery or after with breastfeeding. It's sort of a discussion of risk and benefit that should be specialized between the pediatrician or care provider and the parents.
Right. I would think that that'd be a challenging thing to think through as a parent and having a newborn and the pros and cons. And so that'd be really difficult. I can see why there probably isn't consensus, especially because this is such a fast moving event and pandemic, and we're learning more as each week goes. So what about delivery? You were going to talk a little bit more about that.
Yeah, so for delivery, we've sort of seen the pendulum swing from side to side already on those recommendations. About two to 3 weeks ago, in the U.S. epicenter of COVID-19, New York, many of the birthing hospitals were prohibiting partners from coming into the delivery room with their pregnant partners. And so women at that time, and I think it may have been a span of about 5 to 7 days, were forced to deliver on their own without a support person. In response to that, there was a petition that what actually reversed the policy at many of those hospitals. And so now the policy is different by hospital in New York, but what they're doing is having parents come in for testing the day before or upon entry for delivery, depending on if it's, an induction or scheduled delivery versus just a spontaneous delivery. And then if the status is unknown or positive, then everybody is gowning up for deliveries. And so, they actually reversed that more conservative recommendation because they realized that, this is infectious. We do need to limit contact. We do need to take precautions, but we also need to be supportive of, our mothers in the delivery room, and they do need that supportive advocate there for them. So, so a lot, it's being left to the institution how that is managed. There isn't a national recommendation on that from, obstetricians and gynecologists or from the American Academy of Pediatrics. But it's changing as we learn more information. So for right now, partners are coming into the delivery room, and depending on the institution and the presence of symptoms, they are taking precautions.
Okay. What other things have you been seeing or considering as a pediatrician surrounding COVID-19?
So the general recommendations by the American Academy of Pediatrics are for children under the age of 2, it's very important that they continue to have their well child checks in person with their pediatrician or their primary care provider for their child, and that they stay up to date on recommended immunizations. And the main reason for that is twofold. They've made this recommendation based off of a risk-benefit analysis of the potential for exposure by coming into the physician's office versus the risk of the diseases if the child is not immunized. And the diseases that we are immunizing for children under a year of age are diseases like bacterial meningitis and whooping cough, diseases that are, fatal or can lead to severe neurologic devastation if the child is not immunized. And in the recent past, when we've had shortages of different types of immunizations, for example, that protect against meningitis, we have seen a spike in bacterial meningitis, and we've seen the devastating effects of that. And so when we're doing a risk-benefit analysis of infections that infants and children under a year of age are at higher risk for and are known to be neurologically devastating or fatal, compared to this new infection, COVID, which is devastating to certain populations, but we haven't seen that in, infancy or in children. We are strongly recommending that children stay up to date on those immunizations. And then at a year, we are continuing, between a year and 2 years, we're continuing some of those immunizations that protect against meningitis, but we're also starting the measles, mumps, rubella, and the chickenpox series. And so those are also considered very, very important to stay up to date on. But what we are also hearing from the American Academy of Pediatrics is that when appropriate, consider using telemedicine as your first line of contact with your physician. And that's because, in doing the risk benefit analysis, we are not increasing exposure to COVID in those situations. And we are able to provide a lot of care telemedically. And there are clear limitations to what can be provided. Emergency situations still would require that a provider come in. And obviously, just, as I said, well child visits that require immunizations would require a direct contact. But we're trying to branch out and provide care without increasing risk as well.
Right. I had reached out to my doctor too before a couple weeks ago when I wasn't feeling well, just to see if I could just stay out of that clinic and kind of talk through some of my symptoms. And it ended well for me that way because I just, got more asthma sprays and some different things like that. So just trying to lessen the amount of people out there. So what about, so you said under 2 coming in for a well child, and then over 2 to 10, you're suggesting telemedicine first, or what are the recommendations?
After 2 years of age, the recommendations for well child checks are yearly.
Okay.
And so right now, the American Academy of Pediatrics, strongly does recommend to continue well child checks. But while we're in peak epidemic, we're not recommending that kids over 2 come in right now for the well child check. And, none of us can see into the future, but basically the reason for that recommendation is rather than bring kids in at the peak of the spike for coronavirus or COVID-19 and potentially exposing them for something that can be done anytime over the next 12 months, wait until we're starting to see a steady decline in the peak and then get them in at that point. Some states actually have started to cover for well child checks telemedically, and then be creative with reimbursement for that and be creative with how immunizations are being given. So every Wednesday, since this started, the national leaders for the American Academy of Pediatrics from different states come together with the national organization, and we have a weekly meeting with updates. And in some states like North Carolina, Vermont, Washington State, they are starting to work toward actually doing well child checks telemedically as well, where appropriate. And in some practices, there have been alterations that have been made for where we see well kids and where we see sick kids. And some practices have seen well kids only in the morning and sick kids only in the afternoon. Some practices have been doing immunizations out in the cars, so people are not coming into the practices, they're going out to the vehicles and doing them. So we've been really creative with trying to meet what our patients' needs are while maintaining the care recommendations that we've always made. So, things are changing and unfolding, and we don't know how long we'll be in this sort of hold situation. But for right now, for those children over 2 years of age, we are recommending waiting until we're starting to see a decline in the COVID cases before we have them come in for their well child checks.
Okay. So what do you recommend for families and children? Right now, there's just a lot of stress regarding the unknown. A lot of families where the partners or a partner is out of work, and then maybe homeschooling and on top of their normal work. So do you have recommendations as far as protecting children's mental health and making sure mom, dad, partners are well too?
Mm-hmm. This is a tough time for all of us. And I think that it's, my recommendations are going to come from a place that I commonly will talk with new parents about, because really we're all new parents in this experience of coronavirus.
Right.
And as we're all in a time of transition, we need to be patient with ourselves and obviously be patient with our children. But it's very difficult to be patient with your children if you're not first patient with yourself and your needs. Right. And so all of us are feeling anxious right now. All of us are uncertain of what we're walking into moving forward. And so it's very difficult to feel like we can develop a plan or feel secure in a plan at a time like this. I think it's important for families to prioritize needs. So prioritize our basic needs first, and then kind of move from there. So our needs, getting linked up with organizations first, if we're looking at our hierarchy of needs, we need to try to secure food, secure shelter, secure sleep, and then cultivate those relationships that we have before we can even think about school and learning and planning and any of those sort of higher level things that we're doing. And Dr. Bruce Perry, you guys hosted Dr. Bruce Perry last week, and he's a psychiatrist and an expert on really how the brain works and how we function. And I appreciated his presentation because he really talked about how our brain works and how in order for our brain to work, we need for our basic needs to be met and for our emotions to be regulated. And right now, I mean, I don't know how you all are feeling, but I know that for me, it's hard to stay consistent with feeling emotionally regulated at a time when there's so much change, and so much unknown. And so, I think accepting that about this time is really important. We're asking parents to stay at home and work and teach their kids and cook. And, I mean, there's a reason why these things were separated before, because it's really a difficult task for any one person to do. And I think that it's going to require us taking some things off of our plate and prioritizing the other things to be able to be successful. A friend of mine who is a close friend of mine who's an electrical engineer by training, but really a PhD science educator. When all of this started to go down, she, for her living right now, she coaches basically schools and teachers on how to deliver their math and science education. And she said, there's no way, that we're going to be able to transition all of this to online education. We're learning new tools. We're doing it at a time of increased stress. We have a new teacher because parents now are teachers. And for a lot of us, it's causing us to have more stress to try to implement these school-based programs. And it's all, with good intention, right? We're all trying to maintain how our kids are learning and maintain some normalcy during times where so much is unknown and so much is not normal. But I think an important part of our daily school activities is going to be building in things that can help us emotionally regulate. So, with my kids, I mean, we do cosmic yoga, which I love. And she takes us through like a story time where we're doing yoga moves, but we're listening to a story. And even for me, like that gentle distraction of taking a trip through yoga is really a nice mental break from some of the strains of reality right now, but also allows us to tap into our bodies and movement to help regulate. Music is something else that I think a lot of us fall back on. So, I think that trying to build what we need into our days and to remember that we need balance too. It may require taking some things off of the plate, but I think it's really going to be important in the large scheme, the large scheme of things, keeping things together and maintaining our mental health and modeling that for our kids as well.
Right. Yeah, I think it's important. It's definitely different to homeschool. I have a 12-year-old at home, and it's definitely different to monitor that and then to encourage and then hold accountable. And I feel like sometimes your children probably listen to their teachers maybe a little more about homework situations than they would otherwise. And so even this morning for me in our household, I went for a walk this morning, and I think I had maybe Metallica on this morning. Just trying to
Yeah.
walk around before I started my work day so I could, think clearly. And then I shared with you before we started this interview that I was having the worst time getting Zoom to record appropriately. And then by the time we got on the phone, I just, it was just, you're just already, the day had already a lot more anxiety than you had anticipated. So it's interesting times. And yeah, Dr. Bruce Perry helped a lot last week as far as, you know, understanding the science behind it, and then also, understanding the importance of putting together a schedule and how that contributes to regulating your own emotions, but making sure you're flexible and taking things off your plate and just not trying to overload right now. So
Absolutely. Absolutely.
so one thing I want to talk to you about too, and I was pretty excited when you did this, because just something I think we discussed before, is you started a new practice, and you are a founder of a new organization / practice of Nurturing Wellness Pediatrics, which specializes in pediatric telemedicine. So why don't you tell me just a little bit about that and kind of next steps with that, so if people are interested, they know kind of how to reach you. I know I get your blog in my email every morning, so
Oh,
thank you.
thanks for
I like it.
signing up, Sandy.
Yeah,
Yeah,
good.
so Nurturing Wellness Pediatrics is my new pediatric integrative telemedicine practice, and it was just launched April 9th, so is not even 2 weeks old right now. Basically, I had various challenges, personal challenges, health challenges over the past several months, and was out on medical leave up until the beginning of March. So I came back into town the beginning of March and was still healing up from surgery. And then just as I was feeling stronger and getting ready to restart my practice, COVID hit and everything got shut down. And so where my initial plan was to transition into a brick and mortar practice with telemedicine, it made more sense because of everything else that was going on to start off as a telemedicine practice solely. And telemedicine is something that has always been on my radar. I've been, I've been interested in it for years, and really my interest in telemedicine stemmed from my background. The fact that my parents are from developing countries outside of the US, and the ability of telemedicine to provide care in areas that were underserved outside of the US was something that was always interesting to me. But in a rural state like North Dakota, telemedicine has such great utility, because then we can provide more equitable care across the state in areas that are more physically limited. And so, I'm really, really excited about the ability to help to improve the disparities in pediatric healthcare that we see in North Dakota by providing care telemedically. So continuing to provide care to all the patients that have come out to Bismarck to see me, whether they're in Bismarck and Mandan or, 3 hours away. But then also being able to expand the care that I provide to areas where pediatricians might not be physically present and able to practice and able to advise. And I really think at a time like this, it is important to know how to access care, to have a trusted provider that you can access, and then to be able to access that care when you need it. So during the days, in the evenings, on the weekends, that you have trusted care that you can access. So Nurturing Wellness Pediatrics has allowed me this forum for providing that care, and allowed my patients and future patients a point of access that they didn't previously have. So I'm really excited about moving forward with this. A lot of patients have questions about insurance, and actually with everything that's going on with coronavirus, we've had really great coverage for insurance for telemedicine, because they're encouraging it. And I am in the process of credentialing with various insurers so that I can provide care to all the children in the state. But we've started out with Blue Cross Blue Shield and most Sanford Health plans, and we're in process with Medicaid and various other plans. So we're looking forward to being able to provide care to all kids within the state.
Good. Okay, and then so if they just Google Nurturing Wellness Pediatrics, they will find you or Dr.
Yep.
Kathy Anderson. Also, we'll be posting this on our YouTube and Facebook site, and we can have a link to your practice.
Oh,
And
thank
yeah,
you. That'll be great.
and then another thing that we can add is different information from the American Academy of Pediatrics. I think I'll put a link there so they can see what and reference what you were speaking about as far as recommendations. So
Absolutely. Yeah, the recommendations are ongoing and updated on a weekly basis. We do also have some links through the North Dakota American Academy of Pediatrics website
okay.
for COVID information. And we have another meeting for physicians and providers for North Dakota American Academy of Pediatrics later this week. So we're happy to be a resource for you all as well. Please let us know via the website if there's additional questions or services that we can provide.
That sounds good. I think at this point, I will just thank you for taking the time and talking with me and talking about COVID-19. And I think it'll be very helpful to families as they're trying to decide how to operate within this new way of life for the time being. And at some point, this will pass, and hopefully, sooner rather than later, and we can return to a new normal.
Mm-hmm.
And so there's some positives at the end of all of this.
Absolutely. And I think, as far as parting words, thank you, Sandy and Pecan, for having me here. This will pass. It's hard to say when it's all
Right.
going to happen, but I've spoken with a number of families, and I sort of feel this way myself, that although life has changed in a way that is not in my control, there have been things that have been good about the changes. Life was moving very, very quickly, and we're running from one activity to the next activity, and our meals weren't always together, and we didn't have time to kind of spend that quality time together because we were so involved in all these other exciting things that we can do. And so, now in this little bit of slowdown, we've been playing more games and doing puzzles and dancing together. I mean, like there is a little bit of a silver lining to this dark cloud that's over us right now. And I think some of what I try to do and try to encourage other people to do is to retrain our brains into looking at that silver lining and not the dark cloud, because we can't control that dark cloud. And at least in that sense, being able to appreciate some of the lessons that we're learning through this process. So.
Right. That is just real. Those are really good points. I'll just end on one thing that we've been doing, maybe not more puzzles because we do a lot of those, but we haven't been watching movies together as a family. And so now we watched Call of the Wild. Well, I've wanted to watch that for a long time. So we read the book again, and then my 12-year-old Evan made little movie tickets and popped popcorn. And then when we went downstairs to watch the movie, we gave him our ticket, and we sat and watched that. And it was just a lot of fun. And I think we just forget with our work lives and sports or activities, jujitsu is what he does. You forget to sit down and watch like just a simple movie together, and that was a lot of fun. So
Absolutely.
yeah, so thanks for your time, and I'm sure we will chat again soon, and have a good day.
You too. Thanks so much, Sandy.
Okay, see you.
See you.